Well, as parents know, we know how important connection is for our kids, and many of them had big plans for winter break. But with the rising COVID numbers, how safe is it for our kids to participate in all these various activities? Well, Lindsay Buckingham spoke with local doctors to find out.
As parents, we've all been here before, wondering if sending our kids to the big game is the right call.
The fear is that when you get lots of kids together that are unvaccinated or people that are vaccinated not masked indoors, they're going to be super spreading events.
Pediatric critical care physician with Rainbow Babies, Dr. Kenneth Remy, says to lower the risk at sports games or other activities, this is critical.
I would tell you the most important thing that we can do at this point for children is any child above the age of 5 years old should go through their vaccination.
Then risks go down even more by doing this.
So you're indoors with any group which is not your immediate family, you should always have your mask on.
That includes playing sports with masks on. But Dr. Purva Grover, medical director of Cleveland Clinic's Pediatric ER, says no matter what your child participates in, it's not bulletproof. You're still taking a risk.
And if you're being exposed to them and you know that they are kids on that team or other parents who might not be vaccinated, then it's simply not safe at this point to be around them.
But what about smaller gatherings like play dates or holidays with family members?
I believe that if children are vaccinated, it is very safe for them to interact with one another and be able to have play dates over this Christmas break, still using those same tenets while indoors of wearing a mask.
It goes beyond winter break. With rising cases, both doctors agree masks are here to stay for the next few months.
I would say that it's important at this point, as we leave the holidays in the beginning of January and probably February, to continue to wear masks.
CDC guidelines state that indoors masking is appropriate and probably the safest thing to do. So that is what we should urge our public to do.
And both Dr. Remy and Dr. Grover say the majority of pediatric cases they're seeing in their hospitals are among the unvaccinated. Betsy?
All right, Lindsay, I heard you say in there playing sports with masks on.
Yeah, you did. So basically it comes down to this. If you choose to go to a basketball game where there's a lot of people and you don't know who's vaccinated and who's not, then you are eliminating all the risks by skipping it. But if you do go, being vaccinated is one layer of protection, and also wearing a mask adds another. So it's really about the comfortability you have with taking that risk as parents and with your kids.
Okay, still a lot of decisions to be made. You have to do what makes you feel comfortable and make those decisions as a family and for your family. Speaking of your family, Lindsay, I should just wave to you because Lindsay actually lives right around the corner from me. So we're both coming to you live
Neighbors.
from our homes, which are basically spitting distance apart. All right, thanks a lot. I'll see you soon, hopefully. Jay?